Introducing the new state-of-the-art technology by Exergen, the Temporal Scanner Infrared Temporal Artery Thermometer. The Temporal Scanner is the latest advance in thermometers. It provides an accurate, quick reading with complete comfort to patients of all ages, from newborn to geriatrics. For more than 100 years, the thermometer has been one of the clinician's most valuable tools. One 19th century physician put it this way: the clinical thermometer ranks in importance with the stethoscope. A clinician without his thermometer is like a sailor without his compass. Thanks to infrared technology, the thermometer has now reached new heights, and Exergen, the worldwide leader in infrared thermometry, is defining the way. With the temporal scanner, Exergen has set a new gold standard for temperature assessment. The temporal scanner is the first and only truly non-invasive thermometer that accurately measures temperature while at the same time is completely comfortable to the patient and clinically easy to use. The temporal scanner measures the blood temperature in the temporal artery. Why an artery? Because the arteries, which carry blood directly from the heart, provide the best assessment of true body temperature. Why the temporal artery? It's ideal for several reasons. First, it is located just a short distance from the heart. Also, it is readily accessible, lying just a millimeter under the skin surface of the lateral forehead. Moreover, because the temporal artery is highly perfused and has very little vasomotor activity, a steady flow of blood is assured. And with its terminal fork, the ability to obtain a correct measurement is doubly assured. Using an infrared camera, thermal imaging effectively shows the arterial blood flow to the temporal arteries. Note the steady, solid flow. This is the area used by the temporal scanner to measure body temperature. Exergen offers several options for protection from cross-contamination: the disposable cap, the disposable cover, and the disposable bag. The temporal scanner is extremely user-friendly. Just follow these simple steps. First, place a disposable cap or cover onto the probe. The disposable cap is placed on the probe by a simple push and ejected with a push of your thumb. The disposable probe cover is another option. The cover is placed on the probe by inserting the cleat at the back of the probe through the hole in the cover. Wrap the cover around the probe and place the cleat through the second hole. Then simply tear the cover from the roll. Certain models can be terminally cleaned and used without disposables. Contact Exergen for details. If extreme contamination concerns are present, there are also disposable bags into which the thermometer can be placed. To measure the patient's temperature, place the probe on the center of the forehead. Depress the red button and keep the button depressed for the entire measurement. Maintaining contact with the skin, slowly slide the probe across the forehead into the hairline. Keeping the button depressed, place the probe on the neck behind the ear. Release the button and read the temperature. Within seconds, you have measured the patient's temperature with no disturbance or discomfort. You may wonder why we measure both the forehead and behind the ear. If the patient is diaphoretic, the moisture on the forehead will cause an evaporative cooling effect, leading to a measurement that is somewhat lower than the patient's actual temperature. However, the patient who is diaphoretic is always in a highly perfused state, which means the arteries are dilated behind the earlobe. To account for the heat loss on the forehead, we measure behind the ear. Why not measure behind the earlobe all the time? Because this measurement is too variable when vasodilatation is not present. Let's review the steps. Place disposable cover or cap on thermometer. Place probe on center of the forehead. Depress button and keep depressed for entire measurement. Slowly slide across the forehead into the hairline. Place probe on neck behind the earlobe. Release the button. Read the temperature. The temporal scanner is very easy to care for. It can be cleaned with any hospital-approved disinfectant, alcohol, even bleach solutions. The probe lens should be shiny clean. If not, wipe with an alcohol prep followed by a swab or sponge dampened in water to remove any residue from the alcohol. To change the battery, simply remove the screw in the back of the thermometer and replace the battery. If you have any questions regarding the use of the temporal scanner thermometers, or if you would like to have additional information, please call us at 1-800-422-3006 or 1-888-838-9073.